So this video is the testimonial from Dr. Cole, and he's one of the head of the hundreds of ER department. Big shot down from the south, but he's kind enough to allow me to show his full face. And before he share his experience, I'm going to show the audience what Dr. Cole looked like. So then you can see that was him. He actually had two procedures. But there's no artistry in terms of the hairline. It's just too high. It doesn't look natural, and then the density is poor. And then we lower the hairline by both temple too. And so this is close up look on the left side, on the right side, and we lower the hairline. And top view. And this is where Dr. Cole now with excellent density. Okay, go ahead. Start from the beginning. Go.
All right. So some of the things we talk about when being a man losing your hair, it affects everybody in one way or another. And nobody wants to lose their hair. We hear all the sentences about hair loss, and but that's from people who have hair. The reality is it affected me personally from a confidence perspective. And trying to wanted to look at what I could do about doing that, and so I went ahead and started doing a bunch of research. Being in the medical field, being a physician, you start to know how to look folks up, and I was able to run across Dr. Deep and have looked at some of his work from the past, and started to get. It doesn't take long to find a physician around who will know somebody that you know, and consequently, Dr. Deep and I had actually gone to a medical school together at different times, but at the same medical school. And so I felt very comfortable coming out here and choosing Dr. Deep to do such a procedure because, as Dr. Deep has mentioned, it isn't just about putting hair on the head. We've all seen the cornrows of folks. We don't have any of that. My hairline today is completely natural. Nobody knows that I've had a hair transplant. We're in the middle of this COVID thing, so I can't get a haircut, but normally my hair is very well groomed, and you cannot tell that I've had a hair transplant, especially looking at the front of my hairline. My hairline is perfect. The scheduling a surgery date and getting in here, you come in, it's very comfortable, it's very simple. There's the benefits of the medication. You don't remember any of it. And it's really not a painful procedure. You go through a day where when you walk out of here, when you get to take the bandage off the next day, you see that there's coverage in places you haven't had in a long time, and I think those are incredible feelings. And so the healing part of it, again, it's not very uncomfortable. It's there's a little bit of tightness in the scalp when you get done. But then the numbness does wear off, and then the sensation all comes back, and then you gotta go get haircuts again. And talking about the haircut in just a second, but the growth in and of itself comes. It can take up to a full year to get everything there, but the reality is within several months you've got a full head of hair compared to what you had. And I had to go to actually Supercuts and get a haircut. And when I went to sit down, I was actually nervous because I haven't had a haircut in about 25 years. Because I used to just shave my head. And now no matter where I go today, and with a full head of hair, my confidence is certainly better. Nobody wants to lose their hair. I mean, it's the reality of it. And I love getting haircuts. I love shaving, combing my hair and getting ready to go out. And my kids now they laugh and play with my hair, and they think it's great. So. Yeah. It's been a very incredible experience.
Thank you, Dr. Cole, for sharing your experience with the audience. As he mentioned, other client was showing their, allow me to film their face, and some of them would cover the face, but it did help him. And so he just returned the favor and, to show the audience, hey, hair transplant does work. And,
oh, yeah.
And, he's been bald for many years. He's tired of shaving it. And then there's treatment for it, but again, hair transplant surgery is very dependent on who doing the surgery. As I mentioned in many of my videos, it's not just density, it's artistry, and it's and if you follow my work, I take pride in my work, and I want to make sure that every patient I do is like my plain canvas, and we want to make sure that we give them the most natural and custom hairline that fit their face, and and bring out the look, the handsome look, and the youth as well. And so, so hopefully the audience get a glimpse of that. And I know Dr. Coates is anxious to get his hair cut. But at least, you know, now that's a problem to have. It's a good problem
Yeah,
to have.
absolutely. I love spending that, $30. I will say, I do a lot of TV interviews today, especially during this COVID thing, and so going on there with a full head of hair has definitely made a difference. I am far more confident with respect to that. Whether we want to admit it affects us that way or not, it's the reality. It does.
Yeah. So, can you share a little bit what do you do? You're the head of the ER
So
department?
I'm a regional medical officer, and I oversee many emergency department for different facilities across the United States. I have facilities from Florida all the way up through New Hampshire, and so I'm constantly in different settings and in and out of meetings where I'm helping direct the medical directors of the facilities to make sure that we're having standard protocols and policies and procedures to provide the best possible care to our patients.
Yeah, well, you see how his job is. So yeah, he's a perfectionist himself. and again, it's when you do research, you want to make sure you just don't want to go two things you don't want to do. You don't want to go based on price, cheap price. It can get you in trouble. Because sometimes it's too good to be true, and then you don't want to go to someone locally. If the doctor is good and it's local, is fine, but you don't want to just go to the corner surgeon who happen to be close by you. If you find a surgeon that best fits you and have shown the consistency and the artistry and the density of the work, then you can definitely gotta travel. And Dr. Cole is all the way from the south.
From Panama City Beach, Florida, and
Yeah.
I think you bring up an incredible point. The idea here is not necessarily just because I can go down the street to get it done. When you sit down with Dr. Deep and you go through the procedure, he wants to know what exactly is important to you, and we just actually went through this today to say, okay, where exactly do you want me to focus, and we're able to talk through that, and that's going to give me the result that I know because I'm the one who styles my hair every day. And that's a huge benefit because no matter how we look at it, we are always in control of our medical care. And that's a big benefit when you can have that level of dialogue.
Yeah, because we want to make sure we work with the patient, and we want to together the patient's idea, and then I'll take the patient idea and their concern and their goal, and we want to make sure we hit the goal from top to bottom. And so that way, I find out patients more satisfied with that when they have more control of it.
Absolutely.
And we work as a team, and ultimately we want to make sure what's best for the patient. Not unless the patient want a really crazy stuff and hairline near the eyebrows, and then I will guide you away from it.
Sure.
And in fact, I actually refuse a couple patients who want a really crazy hairline or just something that's not. Again, my reputation is really important to me.
Absolutely.
And walking around, you like my walking billboard, right? You advertise with my
Absolutely.
work, so and see, he has very excellent density and excellent result, and it's look, see how natural that is, and we're going through, all that stuff.
And if I pull all my hair straight back, if I can lift it up, like you give a hairline shot, my hairline is perfect.
Yeah.
That is a completely natural hairline. I know when I look in the mirror, I'm like, there's no way anyone can tell I've had a hair transplant.
Yeah, and that's really, really important, because you don't want
That really
people to
is.
figure that out. You have surgery, and then that's what separate my work is not just the density, it's the artistry of the hairline. And so if you can turn to the right for me, turn to the left, go ahead, look straight, and look down for me, and look straighter. Thank you.